I'm a physician.
I'm an ER doctor.
Physician assistant.
Emergency medicine physician.
Vascular surgeon.
Primary care doctor.
"72 hours since our first corona patient."
2 semanas.
3.5 weeks.
It's been about a month.
4.5 weeks.
5 weeks ago. This is the 5th week.
About 5 weeks ago.
5 weeks.
We saw our first case at Northwestern in early March.
About 6 weeks ago.
7 or 8 weeks ago.
8 weeks.
12 weeks.
We have 2 positive cases at our facility currently.
Hasta el momento 2.
Now we have about 30.
There's around 30 positive cases.
In total, we have 94 patients in the whole country in the ICU.
For the whole of Washoe County, I know there are around 360.
We have over 400 patients admitted in the hospital.
We have a minimum of 400 COVID cases in my facility today.
We've got basically a 400-bed hospital on a day-to-day basis, and it's virtually 100% COVID at this point.
Most of our folks are changing in the garage completely and sanitizing themselves before they enter their homes.
I have wipes in my car because I'm driving patient to patient, so I wipe down my car before and after every visit. And then when I come home, I usually leave my jacket and shoes outside of the house, at least overnight.
You change out of your clothes outside of the home. You basically immediately shower. At the hospital, I have my protective equipment stashed in a place that I know I'll be able to find it, and going to take very close care of that protective equipment as well.
Disinfect my shoes, immediately my clothes, myself, the surroundings, anything metal in my home, anything metal in my car is disinfected.
Making sure that your phone is in like a sealed plastic container, your hairnet, and all of the kind of usual precautions. And then as soon as you're home, making sure any clothes that you've been wearing, even just out of the hospital, are kind of thrown into a high degree wash.
I take off everything before I go inside, including my white bunny suit, my gloves and everything. And I put that outside for fresh air to kill. And then or put in the oven, 70 degrees Celsius, my masks. And then I take off all my clothes, strip completely down, put it into the laundry, and then take a shower and let it run. It takes about 30 to 45 minutes.
Have dedicated footwear to go back and forth to the hospital.
I usually shower at the hospital, but I leave my sneakers outside. I put Lysol on them. I wash my cell phone with alcohol, my hands. I take out all of my clothes. I put them on a different basket in the laundry.
Psychologically, it is stressful.
Obviously, I miss being around my family a lot. That's the hardest thing.
I am having nightmares at night, which I've never had before in my life.
Ahora empezamos con el insomnio. A la noche que uno no puede parar de pensar en cómo puedes hacer estrategias para que dentro de esta pandemia, y que más adelante seguramente va a ser peor, por esto que entramos en el invierno nosotros ahora, pero sí, por momentos tengo angustia, por momentos digo, bueno, venimos bien, y digo, espero que todo esto que estamos haciendo sea en vano y que no las tengamos que usar todas las camas que se están preparando en un montón de lugares, pero genera estrés.
As the day passes, you learn how to put on your ear, you shower like 3 times a day. It becomes a routine.
With all of the new changes and how protocols are switching from day to day, are those things enough? Or, are we going to find out that we need to be doing more? Or
It is, sad to see a lot of these patients, be on ventilators and things like that. You got to be as professional as possible as well.
Broke down 3 weeks ago in the middle of a shift. I never break down. What's going to happen to our mental health afterwards? What's going to happen to us afterwards? You're going to have a huge wave of survivor's guilt after this pandemic is over.
I mean, it's definitely been exhausting. I want to be really careful not to bring the virus into someone's home.
I feel good because I know that I can do something for my hospital and for my country and for the people, which is good. It makes you feel good.
We're starting to see some real hope for getting some of these people back to their families and back to productivity.
Asignar quiénes iban a ser los médicos que tienen que hisopar a los pacientes sospechosos, porque nadie quiere, así que fue aleatorio.
I've had a patient who's 84 who I've seen once a month for the last 2 years. I have had to tell him that I cannot see him at home because I don't want to even take the chance that if I were to come into his home and potentially give him the virus, that would be extremely detrimental to his health. So I'm really his only social outlet at this point. He doesn't have a close family and otherwise, and it's been really tough for him to have to be in isolation without proper care, with someone he's relied on for the last couple of years.
So the decision as to when you intubate somebody is a particularly weighty one with coronavirus, because the data that we have at our disposal shows that it's difficult for many of these folks, the majority of these folks really, to get off of the ventilator. So making that decision has become, it's already a complicated decision.
So there were a lot of difficult discussions over the telephone with devastated family members who had their relatives dying in hospital with nobody around. And that was very, very difficult, those conversations over the telephone when you can't even really build the rapport that you'd like to, because the telephone, you can't see people's emotions, you can just hear crying.
And unfortunately, there are times when the virus wins, and we have to decide that we've done all that we can for that particular individual, and nobody likes to give up.
This patient we treated on Tuesday, she had been with a tonalized catheter for 15 years, and she had no access. So we were trying to get some venous access so she can get dialysis because she could not be dialyzed for 10 days. And she coded on the angio suite, and our decision was to, what do? We don't have a lot of ventilators. She's more than 70 years old. What's going to happen? But at the end, we did the cardiopulmonary resuscitation, and the patient is currently on ventilation. She got one dialysis, but being unstable, sometimes you cannot do the whole dialysis. But you always think that, okay, this elder patient, she's going to get a ventilator, then you could give to a younger patient. And at the end, well, she was not a COVID patient, so we decided to intubate her and give her all of the maneuvers that we could.
I will say that it is incredibly difficult from an emotional standpoint to interact with patients and their family members. We don't let visitors into our hospitals, and there are no hospitals around this country that do, right? Our whole workflow around that is different now, and so it's crazy to tell someone, hey, your family member is critically ill, but you can't come in here right now.
One of the things that's really been unusual for us is that we are limiting the aerosolized medications. So the medications that we give for people with exacerbations of asthma or wheezing or exacerbations of their COPD, they are really concerned about aerosolizing and causing more spread of infection. So whereas normally when a person had wheezing, we would just put on a mask and a nebulizer treatment, not even think about it. Now we really have to make these decisions. Is the risk to the patient and the crew of having this aerosolized medication compared to the benefit that they're going to receive from having that wheezing or shortness of breath relieved? So 2 days ago, I had a patient who was sick. I don't know yet if they were COVID, but they were definitely in respiratory distress. I went ahead and gave the albuterol treatment with the HEPA filter on, and then stopped it before we made it to the hospital, and it did seem to improve them. So I feel like it was the right thing to do, but all the time I was wondering, is this one really sick enough for us to go that way, or should I wait until they can have a different way of delivering the medication? Fortunately, it worked out, but never had to think about it twice before.
I think the hardest decisions that we're having to make right now in the US and around the world are in terms of resource allocation. And so continuing to have to triage people and make educated guesses about who most needs to be tested and who's most likely to be infected continues to be a struggle. I think the hardest decision still comes back to whether you need to order a test for your patient. Ideally, it would be good if we can do tests for everyone, but
realistically, they're just not the resource to do that.
I think, treating patients with corona is the patient that's asymptomatic. I have, subsets of patients that one is symptomatic and one is not. Who do we test? Who do we not?
It would be nice to have a retrospective scope and say we could have done anything better, right? The issues that none of us, human beings, have been notoriously bad at predicting things all the time. So otherwise we've been prepared for this pandemic. And if anything we can do better is really asking humanity to change human nature.
This has taken a very big emotional toll on me. I miss my children. I miss my grandchildren. And yes, it has taken a very big toll.
I haven't cried yet, but I've definitely been on the brink a couple times.
When was the last time you cried?
Right before this interview.
I'm sure my partner would say that I've been emotionally burned throughout and that I've been horrendously moody, hungry, and tired all the time.
I've got patients with, really life-threatening and serious problems, and me being away from home pales in comparison to all those. But it's certainly an experience that none of us will ever forget as long as we're around.
Like, okay, I'm doing this pretty good thing for my country, but what if I get infected? What if I infect my family? I cannot see my family. And also, it's not easy for anyone, but you have to stay positive. If you start thinking about like all the possible scenarios, you cannot live because you are going to be scared the whole time and sad the whole time.
I can't remember the last time I cried, but it's definitely very emotional. I mean, it's all been pretty hard, to be honest with you, not being able to hold my daughter or my newborn daughter.
The tears haven't been shed yet because I want to make sure that I'm a rock for other people. But this crisis team, we've actually all check in. We have our own internal crisis team for the hospital. And every week we're rotating through, making sure that we've got time together, that we're having those debriefings when they're warranted. And I love the fact one of the nurses who sits on this team actually stopped me in the ER the other day as I was running, like racing by, and grabbed my arm and said, "How are you?" I'm good. She says, "No, really, like, how are you?" And really just kind of nailed that home. Like, I'm checking in with you, sister, And
when I was in the hospital, there were so many, every day you had an opportunity of realizing that crying would have been a good way of, releasing some tension. Never cried for fear, cried for patience, for situation, for friends.
El domingo porque uno no es que llora todo el tiempo. Lo que uno siente es que llegás al hospital y todo el mundo viene con problemas, y vos tratás de resolverlo porque esa es tu función y tratás de ver cómo hacer, y llegás a tu casa a las 8 de la noche como enojada, cargada, dura de contractura, pero es como bronca, enojo, angustia, todo junto. Quizás las lágrimas no salen tan fácil, entonces mi técnica es poner una película triste para liberar esa mala energía. Así que el domingo sí lloré con una película. Y hace bien llorar, es necesario llorar.
I think right now, where we are in Northern Nevada, is just at the beginning. We're going to be seeing a flux of patients, but I can see that it's creeping up and that we are probably just getting into the really high volumes that other more urban areas have been receiving already.
Our rural facility just does not have the capacity to handle the bandwidth for large volumes of patients.
We're exceptionally lucky in Ireland that a lot of the social distancing and government precautions and systems put in place have minimized a lot of patients being exposed.
So right now in Southern California, I think there's a glimmer of hope that social distancing is working. And I think that we're going to start to see more regional differences in terms of caseload.
Kind of the attention span, I worry, of folks has been somewhat used up, meaning that we've been under shelter-in-place or stay-at-home orders for several weeks now, and we are beginning to see some of the messaging on the news that the numbers, even in the worst hit areas, are beginning to get somewhat better. This, in my view, is actually the most critical portion of time, where we have to double, if not triple down on all the preventative measures that we're taking as a society.
It also depends on whether people get frustrated and the weather's really nice and they go outside, they take that risk. Because all it takes is one person to encourage others to go outside, to encourage others. In New York City's back outside and we're spreading into one another. You know, it's a critical mass, then we're going to be back into where we were 3 weeks ago.
I think if people don't stay at home, this will get a lot worse.
It appears that in certain areas, things are starting to improve. And once we get testing more readily available, I think that will make a big difference.
We're seeing that to some degree at Woodhull, and we are hopeful that we're at or perhaps just past the apex of things. Guarded optimism would be a good way to put it.
Hoping that we will see a trend down, but that trend down will take a long time. It's not going to be 1 week or 2 weeks, and it's day by day.
My outlook is cautiously optimistic about the efforts we've done for curve flattening. I don't see the virus going away after this surge. I don't see it going away entirely, and I expect there to be secondary peaks because of the activities we've done so far.
At the end of the day, we're all going to get through this together.
The courage that I've personally seen has been awe-inspiring.
I wish everyone to be safe.
We all look after each other. We all work for the same cause.
You're not alone.
Remember, you're doing important work.
This will pass too, and we are going to make it through it.
I'm proud of you guys.
We can all learn from those experiences.
You will never be prouder than you will be looking back on what you did during this time.
Stay in touch with your loved ones.
Thank you.
God bless you and appreciate you.
Si no nos cuidamos nosotros, nadie nos va a cuidar, que vamos a salir de esta, vamos a poder resolverlo y esto va a quedar como un mal sueño, pero que nos va a preparar para que en el futuro todos estemos mucho más preparados a poder resolver esto con mayor anticipación.
Never, ever lose the strength and the willingness of communicate with people what is the real need, which is telling about isolation, telling about protection, and telling that this is the solution. A good hospital can save an important number of lives. A proper isolation is going to save millions of lives.